this is a filter. We're trying. Can you hear me? Oh yeah, I got my assistant here. She's trying to remove it. I'm prepared to go forward anyways. I'm here live. I'm not a cat. Oh, there we go. Hi. Yeah, I'm Dr. Lawrence Yang, and today we're talking about compassion, unleashing joy in the workplace. We're going to recognize some of the elements of our current cultural milieu at work, and we'll develop a vision for joy in the workplace. I have no financial disclosures. I'm a family doc, wellness chair at my hospital, and an IHI trained QI coach. Yerkes-Dodson relationship is that one where there's like an optimal level of stress. Too much stress hurts us over time. It's not sustainable. But there's an optimal performance level of stress. And I think the pandemic has really pushed a lot of us to the right side of this curve. Medscape did a 2020 survey looking at some of this. They titled the survey or the report called Death by 1,000 Cuts. And it was interesting, of the 12,000 respondents, 80% of them said that before the pandemic, they were already burnt out and that the pandemic only worsened that. The survey respondents also wrote in and said that burnout not only impacts their work life, but that it really impacts their personal lives too. An anesthesiologist wrote, "The conversations with my family are very negative, leads to friction and arguments all the time." An oncologist wrote in, "I really need time to decompress and process what I dealt with during the day, because otherwise I have no energy and I'm ignoring my family." A family physician like myself, I'm more withdrawn and I'm taking out the stress on my wife and my kids. An ER physician wrote, "I'm gaining weight, I'm angry, I'm not sleeping." An obstetrician wrote, "I can't do the things that I used to do to relieve stress, such as traveling, and my hair is falling out because I can't de-stress." A neurologist wrote, "My depression and anxiety are hurting my work and my personal relationships." But for some reason, the survey also showed that a lot of physicians aren't reaching out for help. 52% that, "Oh, I'm okay, symptoms aren't that bad." It's like our culture has ingrained in us that we have to just be martyrs for the system. 46% says, "I can deal with this without a professional. I don't need anybody else." 40% say, I'm too busy killing myself, so I'm not going to do anything." 20% says, "I don't want to risk telling other people. I don't feel safe in my work culture, in my workplace." 6% don't even trust their mental health professionals. I know it says physicians here in this study, but I have a feeling that those of you who are not physicians can relate. Oh, how are the physicians coping with burnout? Some of them are exercising, some are talking with friends, some are isolating themselves, some are eating a lot of junk food, some are drinking alcohol, some are binge eating. Coping can be either adaptive, healthy, or maladaptive, unhealthy. How are you coping? Go ahead and type in the chat box what you're doing. We can't solve our problems with the same thinking we used when we created them. Albert Einstein. In the pandemic, there have been many challenges, and humanity has responded with innovation. We've designed amazing methods for improving our immunity against COVID-19 with novel mRNA mechanisms and at a record pace, so fast that not many people even trust it. I've gotten both my shots. I hope everybody does. Perhaps some of that new thinking is that an antidote to burnout, maybe to increase joy through the technology of compassion. So what are some of our opportunities for joy at work? I think they lie in generally two buckets, two domains: individual behaviors and the systems level behavior, systems improvements. Individual behaviors start with self-compassion, and the systems level improvements starts with compassionate leadership. Let's first talk about self-compassion. So what does it mean to be compassionate? One definition is, first, choosing to feel, choosing empathy, while at the same time choosing to help. So are we choosing to allow ourselves to feel how we feel, accepting it, and then choosing to help ourselves? Dr. Kristen Neff wrote a fantastic workbook, the Mindful Self-Compassionate Workbook, that I really recommend. And she wrote that self-compassionate people take time for themselves. They ensure that they maintain their empathy. They preserve their empathy through maybe some type of meditative or mindfulness practice, be it prayer, music, singing, church, temple, dancing, worship time, family time. Compassionate, self-compassionate people are kind to themselves. When things go well or when they fail, they take time to treat themselves as a good friend might. From self-compassion comes self-care behaviors like hobbies or exercising or spending time with family. How do you perform self-care to maintain your happiness, your joy? Type in the chat box. Let's listen to Dr. Rebecca Howse, and let's hear from Nurse Josephine Agudo. Welcome, Rebecca. Last name is pronounced House, just like a house, right?
I mean, technically it's more like Howse, like how's
Ah.
it going? I also work for Foundry Victoria with the youth, and I also do outreach to Howalt First Nation, which is just up island. And I work for the new FNHA Virtual Substance Use and Psychiatry Service. So I'm supporting
Wow.
First Nations people that are across the province with that.
And that you're always looking out for people who are marginalized. You really recognize the interdependence of all humanity, and you're living out that. I think I would call it a First Nations worldview of how everybody really is interdependent and connected.
Yeah.
And
I'm Métis. I'm
Métis.
Cree Métis. Yeah, we're about 3 generations off reserve in my family. So I was raised by, my Métis dad and also my white mom. So
what's something that you did in the pandemic that made yourself or some other people feel better?
So I picked up beading, which is a thing that I've done previously. I was in a beading circle during medical school and I learned a little bit then. And then I knew a little bit about beading before the pandemic. I don't know if I would have ever called myself a beater before the pandemic. I knew some of the basics and I had definitely done some throughout my medical school training and then hadn't touched a bead in years. But pretty early on in the pandemic, I decided I wanted to get back into it and I messaged an acquaintance, I'll call her at the time, but she's actually a pretty established artist, and she connected with me with a little bit more of our history as Métis people in our beadwork and the styles that we do, and we're known as like the floral beadwork people. I actually find it really quite meditative. So here's just a little flower that I've done. These were gifted to me by a dear friend a number of years ago. I am struggling to learn how to do beadwork this style. It's finicky. I prefer where you're beading onto the fabric. That's called flat stitch, and this one's called brick stitch. I'll do this one, and this was this was sort of a process piece.
It looks like some type of root crop that has roots, but somehow it's rooting in space.
Yeah. So I mean, this has so much meaning to me. I lost my dad.
Oh my gosh.
And he loved radishes. So this is a radish, and it is also, you can't tell, it's also an anatomical heart. And so this was like a grief process piece and like a whole bunch. And it really helped me process some of those emotions and some of the stuff going on with the pandemic too. But it was really finding some way to express that love that I had for my dad and a reminder that he's still with us. It's a piece about hope. And it's really been a really healing process for me. And it's been a really great way to connect with my culture and my heritage and with other Métis people.
Well, thanks so much, Rebecca, for spending the time with us. And I think you might inspire some people to do some beadwork. you might be the first beater that I know. So that's awesome. Listening to Rebecca's story has got me in a mood to go somewhere tropical. Somewhere, yeah, like this. Beautiful. Oh, it's hot. Well, let's take a listen to Nurse Josephine. Let's see how she manages her own wellness. That's better. You call yourself someone who works in long-term care? Is that what you would call yourself?
And yes, I do. I'm an educator and resource person for the people who live and work there. I'm a certified GPA, Gentle Persuasive Approaches coach, and Pieces champion. So I provide training on both of those topics. And I've also helped with consultations with responsive behaviors.
Josephine, was the pandemic pretty challenging for the long-term care community? And, what was it like?
Yes, it was difficult. Professionally, what was challenging about it was the unpredictability. It was like from the beginning, it was flying the plane while building it. Also, what was important to me was our ability to lean on each other and to know that we were in it together. So
what are some of the other ways that you coped with the pandemic?
The other ways that I got through the pandemic are through prayer, hiking. I took on paddleboarding and constantly generating myself from an empowering context. And what I mean by that is setting aside thoughts from point of views that didn't get me into action. And one of the actions that I took led me to submit an application to EGAL Canada. EGAL is currently conducting a study about LGBT plus seniors persons living with dementia, and their unpaid caregivers.
Now, if somebody wanted to get involved with this project, how do they get in touch with the researchers?
How a person can access the study is by going to egal.ca/dementia-study. And
many of the health professionals I know actually were trained in a time where a lot of this terminology didn't exist. But I think the terminology has evolved in order to be more inclusive. And this project is being run, as you said, by Egal Canada. And Egal, I think, is French for equality.
Yeah.
Or equity. Yeah.
Yeah.
Okay.
Equality, equity, yeah.
What does LGBTQ I2SA, what does it stand for again? Just so we can share that. It's new for some people, I'm sure.
Yeah, so LGBTQI2S stand for lesbian, gay, bisexual, transgender, intersex, two-spirited, and queer. And there's a plus because there's also asexual, there's pansexual. For the LGBT seniors, what's important and for them is not concerned about the letters, really. It's more about how they identify, their identity, and usually they use the words gay or lesbian. And queer is not really a term that is used as much because historically it was there was a negative connotation associated with it. The newer generation, I suppose, have been able to take the word queer and use it in an empowering way. The 2S stands for two-spirited, and that one is specifically used by Indigenous peoples.
If we want to be safe culture and equity champions, but we can't be part of this survey, what can we do?
You can wear a pin or a bracelet or something that is a visual symbol to say that you are an ally or a supporter. Also, please take the time to learn about the culture, not simply to become culturally competent, but also culturally sensitive, and more importantly, practice cultural humility, which is that you don't know all, but that you have the desire to, and you're willing to provide that safe space. You can also introduce yourself using your pronouns. So for myself, I use she and her.
I know that in the pandemic, your mom and some of your other relatives actually got sick, and it was hard for you not to be able to be there and do in-person care, but you coped by doing internet meetings with family. Also on the internet, I think one of your ways that you expressed your feelings and actually did some healing was through internet DJing, right?
Okay, yeah, so I recently went live on Instagram, and I was, a practice session because as a DJ, I've learned to blend, right? Blending music so that one track, plays on top of another one, and then it's like seamless, right? But this time around, I'm challenging myself to be to scratch. So I call them, they're called baby scratches, when you kind of interrupt a record just near the end of the chorus or something, and then you scratch right into it, and then it's to tell your listeners that another song is about to be played. So that's what I did recently, and I did that with different genres like soca, calypso, Afrobeats, dance hall, kind of in that realm of just songs that get you moving and dancing. Just
now that we've heard those great examples of individual behaviors, what about at the systems level? Each of us are called to lead in the systems level. You do not need a formal leadership role to be a system leader. Compassionate leaders can work from wherever they are. Michael West brought the concept of compassionate leadership from the UK's King's Fund, which is their quality council, to the British Columbia Quality Council 2 years ago. I recommend you check out his talk on YouTube. It's fantastic. According to the King's Fund, a compassionate leader is someone who's authentic, optimistic, interdependent, concerned about the overall community, and of course, self-compassionate. Self-compassion breeds other compassion and generates what Michael West calls virtuous cycles of compassion. When we talk about quality outcomes, healthcare outcomes, and quality patient experiences, it really begins on the inside each of you, and then it works its way out, as Bob Moad says. The domains of systems level infrastructure for joy that we can all work on include safety and purpose. Are people feeling like they're doing what they're there to do? Are the patients receiving great care? Are the patients having good experiences? Autonomy. Are the staff empowered to be creative and to make things happen so that they can do a better job? Right? There's nothing better to drive joy at work than helping people do their work more effectively and with less frustrations. Community. Do the staff feel a sense of belonging? Is there a sense of equity there? Are things fair? The acronym SPACE, safety, purpose, autonomy, community, and equity, can help you remember for guiding some of our change projects as leaders within our system. Now let's go back to Josephine. Josephine, tell us about a tip for increasing safety within our workplaces, psychological safety.
My first full-time role was as an assistant director of care at a long-term care home, where staff have worked for 25 years plus. And I was maybe like 22, 23 years old. And I learned very early on to praise people in public and provide constructive feedback one-to-one. And it was, I believe it was this respect that comes from me to them first that made a difference in my relationship and how I was able to connect with them. And, it was respect for their wisdom and their knowledge, and because they have so much knowledge, experiential knowledge. And my job as a leader was to listen for their greatness and to listen for their commitment. And what I mean by that is that I know that they care for people and they want to help people. And so that was the commitment that I was listening for.
As a QI coach, one of the things we always say is that without equity, there is no quality. I understand that one of the ways that you coped was leaning into some of your equity advocacy in healthcare. Tell us about that.
For me, creating a space for LGBT plus seniors to have a voice is something I'm passionate about, because self-expression and being known and heard are much needed these days, especially for this group of individuals who've had to hide themselves for decades out of the necessity, to choose between life, which is, muting their identity in order to, to live peacefully and survive, or death, which is outing themselves and risking being institutionalized or killed. And so it's time to transform that world now. And
I really appreciate you coming on today, sharing part of your story, but also I think you helped me to collect some stories of joy coming out of advocating for safety, or connecting with purpose, patient experiences, finding the autonomy to make change in their workplace, fighting for a stronger sense of community, and advocating for equity. Let's hear those stories.
Just so many heartwarming stories. I gotta tell you, Mr. Sheriff sort of bring light to the things that are also happening within the care homes that are not often heard. Well, so yeah, I hope you like them. They're gems of stories.
Let's start with listening to the story of Anna, an administrative assistant.
I have the opportunity to help to send out hypodermolysis kits to the care homes, especially during the outbreaks. And it was very important for me to see that I was able to help others, even indirectly with my role. And it was amazing to see that in a team, everyone has a role, and my role also could help others to get better and to improve their quality of life.
This one's for you, Pop.
And here's Chantal.
You are a speech and language pathologist at Lionsgate Hospital, right?
Yeah, a 99-year-old woman who came in, who had just recently moved to a new facility and hadn't had a chance to make any new friendships. And then she unfortunately had a stroke, which left her with a fluent type aphasia and a significant difficulty communicating. It also is a type of aphasia that leaves people, other people thinking that they don't have any cognition anymore, because it makes them seem very confused. So after she was discharged home, she had to quarantine for 2 weeks and was super isolated, and also had trouble communicating with people on the phone. So in that time, I spent communicating with her son and the people that she was close to, and developed a communication book that she could use when she's communicating on the phone, and then with other people in her facility, so that people actually know that she has had a stroke and she's actually very cognitively intact, and is just having trouble communicating because of her stroke. So she's using the book, and she's starting to make friends and in her new facility now. So
what's the next video?
Video of Rosalind from a home that's in the downtown area that their home is identified long-term care, but they actually serve a very special population in a sense of they're not necessarily your typical resident who would live in a care home. They're mobile, they're ambulatory independent, and many of them have mental health and also substance abuse sort of backgrounds, also trauma with healthcare system.
We provide for individuals that aren't necessarily welcomed into other environments. They have some history with them. They understand that they have some behaviors that don't quite fit into other places. And so that they're usually the last ones offered or asked. So, and we could see the anxiety rising. They questioned us a lot. Are we going to have to stay in our rooms? Are we going to have to stay in our car? Can we go outside? And because we had to make that decision, we had to make it as safe and not traumatizing for them. We did continue to let people go in and out, but we had to shut down our food significantly, our food services, and have them served instead. And of course, there was no visitors allowed onto the site. And at first we had anxiety, and within less than a week, people were saying, no, this is okay. They got used to being served. At first it was, oh, I can't handle this being served. You're taking away. I don't need somebody to pour my coffee for me. I don't need somebody to do that for me. And they just, at that point, they just were so understanding, and you could see that calmness. And I was so impressed by the group that they were so understanding that we were keeping them safe. And then they started to keep us safe. They started to wear masks independently. They started to do things with us and step away, make distance themselves, because this is a way to make you further safe and for everyone to be safe. They just, again, it was that overwhelming, big smiles, looking like, and the thank yous that the staff got, that I heard individually, that, the counselor would hear, and they would just, and that extended to their families as well, to friends they had that wanted, in terms of, we were not just a nursing team and then a group of residents, we actually became very much a whole team working, and it became very obvious of that.
Let's hear Jazz's story.
A gentleman at one of the care homes I had the pleasure of working with had been there for several years, and over time his health deteriorated to the point during COVID that he was very ill. So in a matter of hours, the team came together to have a conversation in regards to inviting his loved one, his daughter, to come and see him. In the days of COVID, that was a really tough decision. However, the team got together, kind of broke all the barriers and said, you know what, let's call the daughter and get her to come in and spend some time. And when this daughter came in, she was given the full PPE, taken upstairs, and she spent some quality time holding his hand, talking to him, and she was so grateful. She could not stop talking about how grateful she was, and it just closed kind of the loop to her father's journey. So kudos to the team. It just brought goosebumps to me that people still have heart and soul as they're working in such a difficult time, and this is just a beautiful story.
And let's hear Sarah's story.
We had a grade 6 public school class from West Vancouver make us an abundance of beautiful handmade Christmas cards with messages of hope, with "We're in this together, we're thinking of you, don't worry, this will be over soon." The love and support that came from the children was astounding. Our residents were so touched and so blessed by those messages. A lot of them had tears in their eyes while they were reading them and just couldn't believe that children who they didn't know were writing them messages and drawing them pictures and sending love. It was a very touching moment in our building when we were able to distribute those.
And let's hear Joan.
So I'd love to share a story that really touched me about compassion during this COVID time, where at one of the sites that I worked at, I observed one of the residents who lived there start to lose her ability to communicate with her friends and family through her smartphone because of her disease. So the beautiful gesture that I witnessed was that the care staff there, 2 of them in particular, really stood up and filled this gap by making time to spend time one-on-one, where they would sit by her side and take the time to write down each of her words and craft it into a message so that she could share these messages to her loved ones. So that patience, that effort, that care to make sure that connection was still preserved in the face of challenge just touched me so much.
And let's finish off with this story from Loretta.
For here, we had a 99-year-old resident. She celebrated her 99-year-old birthday in a pandemic. And of course, with all the restrictions, we try to do our best to make it as special an occasion as possible. So we did that in the garden, 2 family members standing behind the gate. And also a family member through Zoom had joined us. So we dressed up the resident with a little tiara, so she looked like a princess on that day. And then we had a birthday cake and a whole bunch of balloons and decoration in the garden. And we all had a good time. It's a really memorable day. So even in a pandemic, we got to celebrate all the, little occasions. That's really touched me. And you got to stay beautiful and stay happy, even during the pandemic.
Shout out to Josephine. Make space for joy. Ask questions.